Erectile dysfunction is a condition where the man is not able to sustain an erection enough for him to have a vaginal insertion. So, an erection is supposed to be strong enough to have a vaginal insertion, but if the strength of the erection is not sufficient, or if we feel that there is no erection at all, that is when it is a concern that we need to start looking into. That is erectile dysfunction. This is something which requires a multimodal approach. I think it has to do with our lifestyle. This was never an issue before because most of our great grandfathers and everybody else, they used to have a lot of physical activity, and I think nowadays the amount of physical activity that we do has become less, and it has affected us in two ways. One, in the psychological aspect, because we are not fulfilling what we are supposed to do, and in the other aspect, that our hormones also are becoming less. Like, for example, if we had tested the levels of testosterone in in our great grandfathers, it used to be much higher than the testosterone levels which are there right now. So I think it's a multimodal issue, and finding out where exactly the patient is having a concern with, by doing various tests, we will get to know, and then we can treat it accordingly. In fact, a lot of men who come and seek treatment with us, they're all young boys who are having this issue. So I think age is, of course, one of the important factors. But then again, that's the normal course of how it has to go. So at that point of time, we seek treatment and we take medication accordingly. But uh, if you ask me whether erectile dysfunction per se is an age related issue, it was in the past, but not anymore. It impacts a couple a lot, because I think a healthy relationship requires a good amount of sexual interaction, and when that is not there, it has a negative effect on the couple, and this has definitely led to a lot of men and women being dissatisfied and having divorces, and people splitting up because of this particular issue. Of course, it takes a big toll on the relationships. An orgasm and an arousal are different situations. I don't think arousal has anything to do with this. The arousal is that's a whole different topic. I think what we are talking about is that even after the man is having an arousal, the neurological component is taking a miss, that there is no erection because of the arousal. And orgasm is a completely different topic. I think arousal, not having an arousal, and not having an orgasm are completely separate topics. This has nothing to do with that. Many men who don't have an erection can also have an orgasm, but it's not the same thing. They just cannot have penetrative sex. So that is the only concern. They might be able to orgasm, but they might not be able to have penetrative sex. Not unless they seek treatment. The moment they decide to seek treatment and they understand their orientation and they are quite aware of why they are not having the erection, then yes, once we give these men the basic treatments, I don't think it has to go too far. Just with simple medication, simple antioxidant treatment, increasing their testosterone levels, making sure that they are doing their exercises, making sure they are staying healthy, making sure they're eating right. All of these things are very important. And yes, definitely, all these men who are really, focused on their treatment and health, they will get benefited from, treatment. As of any treatment which has to be sexual and orgasm, it requires a good neurological counseling, a good psychiatric counseling. It also requires them to start training their pelvic floor muscles. And now, recently, we have got this Kegel's chair, which has given a lot of benefit for both men and for women who are having these kinds of issues, where we just try to strengthen the pelvic floor muscles without really having to do a lot of Kegels. Because the only problem with Kegels, what we have found, is that the compliance is an issue. They might maybe do it for like a minute or two, because you're thinking about it. if you want to do Kegels as well at this point of time, you can maximum do around like 10 or 12, because beyond that, you don't have the energy or the patience to go and continue that. So that's the reason why we have this Kegels chair on which the man comes and sits on it, and then it starts contracting his muscles. That do supreme maximal contraction. So if you're able to do Kegels, only goes to this much contraction. The moment you sit on a chair, you get the supramaximal contraction. So it works this muscles for around 12,000 Kegels for around 30 minutes, and it has really been beneficial for a lot of men. So only challenge is, once they do that, they should not let go. They again have to start doing their exercises as well to make sure that there is continuous treatment and don't have this issue of premature ejaculation or erectile dysfunction after this. It depends on the person. I feel the lesser amount of neurological component they have, the faster it is for us to treat, because we're only looking at the anatomical aspect. Once we treat the anatomy, the issue is solved. But if there's a lot of neurological and a lot of anxiety which is associated with this particular issue, then it is going to take them a longer amount of time than someone who doesn't have too much anxiety, and it is just more of a anatomical thing which we can fix by just doing physiotherapy or the Kegels chair. See, again, when you say when treatment has to be successful, it requires compliance. It has to be a continuous treatment. It cannot stop anytime in between. So I think a cure is something which is in our hands. We have to make sure that we are actively participating and we are actively trying to make sure that we are maintaining the same lifestyle. For example, they do all of this, they do all these changes in their life and they become normal. Like, for example, they go for a holiday and then they decide that is the way it is going to be for the rest of their life. Then, of course, it is going to backtrack and they might have to seek treatment again. So making sure that you're always healthy lifestyle, healthy diet, and healthy exercise is important all the time. I think prevention is something we cannot predict, who might get these kinds of issues. So I think we cannot really prevent it, because, no one will really hope or expect to have premature ejaculation or erectile dysfunction. But if there are things that I can tell you, yes, of course, a Mediterranean diet is something which is very, very important nowadays. Of course, a lot of vegetarians, they don't get enough protein. And I think protein is very, very important and is one of the building blocks of our body. So we need to make sure we take either protein supplementation or in ways where they are able to get the right amount of protein which is required by our body every day in terms of diet. In terms of exercises, I think what happens is many men, they just think that if I say exercise, they can go to the gym, walk on the treadmill for some time and things are going to be okay. It doesn't work that way. You need to make sure you're training weights. And you also have to make sure the weights you are training the right way. You have to make sure you're doing enough deadlifts. You have to make sure that you're doing your squats, because all of these things are very, very, very important to maintain a good pelvic floor musculature. So, and of course, taking antioxidants, supplementation is very, very essential in today's time. Because previously people used to believe that if you take supplements, it's bad for you. But I think supplementation is a way of trying to compensate the extra amount of amino acids and things that your body requires that it's not able to get from the nature. So supplementation, diet, and exercise.